This is Laura and Teresa with another episode of Ask Me Anything. This week's question is regarding exams and x-rays. Teresa, how often do you think x-rays should happen and what should the exam process look like?
Well, one thing that we have to remember and often gets overlooked in a practice is only the doctor can order the x-rays and only the doctor can diagnose off those x-rays. So what I find sometimes happens, we have a new patient, for example, that comes in and gets put immediately with the hygienist. And I had an office manager recently express some frustration because the scenario happened in their practice and the doctor did not want to do an exam on that new patient, which they have to do. And the patient, the reason that the doctor did not want to do that was because the patient was not due for x-rays because they had just previously had a full mouth set of x-rays several months ago in their previous dental office.
Mm.
So in the doctor's thinking, if there's no x-rays, there's no exam. But this was a new patient that got put on the hygiene schedule. So, and the doctor did not even want to see them. The office manager was really frustrated. So there's a few things that are kind of wonky about this. Is number one, the doctor must do an evaluation and examination. This is a new patient. They haven't been established yet.
Right.
So why are they on the hygiene schedule? What if they're adults? They could be a perio patient. Who's diagnosing that? Are we just going to do a cleaning regardless of their perio condition and get them back for the evaluation? And the second thing is, if the patient did have films a few months ago, especially in FMX, did we request that? Are they there for the doctor to look at? Doctor can look at those x-rays if they choose to and do an evaluation, use those films as a baseline. If there's no, anything that's really urgent that the doctor feels really needs to be looked at right away or treated right away, everything on the films look good, maybe the films are only a few months old, then perhaps the doctor doesn't need new films, and that's perfectly fine. Films are diagnosed and ordered based on clinical necessity, not frequency, not insurance benefits. There are some patients that are okay with not having films every couple of years. And then you've got somebody that might have xerostomia or some other comorbidity and there's rampant caries. They may need films every 3 months, if they're disintegrating at a rapid rate. You just don't know. It's based on individual needs. And only the doctor can order those films.
That's really interesting to me because I was not, you said a lot of things that I really wasn't aware of, and I wonder how many teams are aware of that. But how does that initial conversation happen so that you can be prepared for that, whether they've had previous x-rays or not? How does the office prepare for a new patient like that with the information they need?
Well, it goes back to what is your written policies and procedures and protocol and how are you trained?
Yeah.
One thing that I can say that's very helpful is to have a new patient intake sheet when you have someone talking to that new patient, and those questions that are asked, how long has it been since you had a dental visit?
Mm-hmm.
Did you have films taken at that time? Did you have, when was your last hygiene visit? And I don't like to say cleaning because not everybody is a cleaning patient, although the patient might think they just had a cleaning when they really had root planing. And they may say, oh no, I go every 6 months. And absolutely, I just had x-rays. So we want to gather things like who was the last dentist and contact them and ask them or the patient's records. And what happens too frequently is we may ask for x-rays, but we don't ask for anything else. So we don't get intraoral photos. We don't get perio charting. We don't get copies of their services rendered sheet. And it's important to do that because we really need to know a history. This isn't, we need to treat our patients as patients.
Yes.
And what is the history on your patient? If they say, oh, I just had a cleaning every, 6 months ago, and you go, okay, and you're writing that down, but you're really not looking at that services rendered sheet. They may have had 4 quads of root cleaning, but they're calling it a cleaning because they don't know any different.
All right.
Or you might look at documentation on their services rendered sheet that may say, this is a perio patient. Patients refused root cleaning, but find out, well, they profied this patient. So now you've got a better sense of, okay, this is going to be probably a non-compliant patient. They've already been diagnosed with perio. They didn't get their perio treated. The previous doctor let that happen, not to treat them, but yet to continue to prophy them. So you're going to be up against now the patient expecting their cleaning. And are you going to do that? Or are you going to, treat that patient with the standard of care and treat their perio? So there's a lot of heads up things that by getting that full accounting from the patient, services rendered sheets are invaluable when it comes to finding out what's going on with your patient. It's kind of telling too, as you're talking to patients or as you're talking to previous providers. Oh yes, they've been a patient here for 6 years. When was their last films? Well, 3 years ago we took, 2 bite wings. Okay, if that's what was necessary, and that's what the doctor felt was clinically necessary, okay. But it also sends up just a little bit of a flag. It's like, okay, so they've been a patient. Have they been a consistent patient? Do they only show up for the last 6 years to put out a fire? Have they refused x-rays and we're treating them anyway? There's a lot of different questions that pop up.
Do you
And
take
so,
this a part of your intake form?
yeah,
Okay.
yeah, I definitely ask a lot of questions, not just of the patient, but I ask a lot of questions of the provider, previous doctor. And sometimes you get information from the previous provider. Obviously they can't say anything derogatory about the patient, but you can, just like a new hire, you can always ask that previous employer, would you rehire this patient? Was this a mutual, why did your patient leave your practice? And they can easily say they were dismissed, or they could say, oh, they moved. They were great. You're going to love Susie. She's awesome. Or good luck with that. I'll send you the record. Without really saying a whole lot. It's like, okay, there you go.
With our last, we have about 1 minute left. With that last minute, Teresa, how often do you really think that happens? How often do current providers, the staff, call the previous provider? Does that happen very often?
I think it happens fairly often, but I don't think they ask the right question.
Okay.
I still don't think they get it. They may just say, when was their last set of x-rays and when was their last clean?
Yeah.
So they're still not requesting the right thing, or, getting enough information necessarily. And we want to set that bar and set that standard for that patient from the initial phone call.
I love that. That is so informative. What a great AMA. Thank you, Teresa, for your expertise and your time. Email or DM us to get answers to your big questions in your dental practice.